healthcare plan of short-term, KAISER True Max. Before we start, let me introduce KAISER International. Who is KAISER? KAISER International Health Group is a health maintenance organization or HMO company duly accredited with Insurance Commission. Our company is likewise registered with the Securities and Exchange Commission on June 8, 2004 as a healthcare provider, with its President and Medical Director, Dr. Leah Uy Yolo, a former Senior Vice President in an HMO company. She is a seasoned expert in the HMO industry, a former consultant, a residency training officer in the Department of Pediatrics, Veterans Memorial Medical Center, a former associate professor in the Faculty of Pharmacy, Medical Technology and Biochemistry, University of Santo Tomas, and outstanding Tomasian for the field of medicine in November 2019. KAISER International is in partnership for success with International Marketing Group. It's a financial foundation builder industry, and it is the only exclusive broker of KAISER. KAISER International Health Group as an HMO company caters to both corporate, group, family, and individual accounts. We're also offering a one-of-a-kind HMO product designed to provide healthcare beyond of an HMO, which is the Ultimate KAISER Health Builder Plan or the Long-Term Care Plan. With KAISER's benefit, clients shall have access to a wide range of our own network with almost 2,000 hospitals, clinics, and diagnostic facilities, and almost 10,000 accredited doctors nationwide. We're also here to attend to your immediate healthcare needs, and we have 24/7 call center services, customer care center, and liaison officer assistance. There are different types of short-term care plan catered by KAISER International, which are the individual plan, family plan, mini group plan, and the corporate plan. We would like to introduce to you now the KAISER True Max. It is a short-term healthcare with rider. Services offered by KAISER True Max. Number 1 is preventive healthcare, inpatient care, outpatient care, and emergency care. Preventive care, find potential health problems before it appears. So you can do annual physical examination like general physical exam, complete blood count, urinalysis, fecalysis, chest x-ray, and for age 35 and above for men, electrocardiogram, and pap smear for women. Inpatient care, it covers hospital services like room and board, operating room and recovery room, administered medicines, x-ray, and laboratory examinations. Professional fees in accordance to KAISER rate like attending physicians, surgeons, anesthesiologists, medicine for inpatient use, intravenous fluids and transfusion of fresh whole blood, ICU confinements, dialysis, and chemotherapy. Here are also other medical procedures and its limit. About outpatient care. In the event that the member suffers illness or injury not requiring confinement in a hospital, KAISER shall referral to specialists, regular consultations and treatment, except prescribed medicines, laboratory, x-ray, and other diagnostic examination prescribed by KAISER accredited physician, treatment of minor injuries and surgery not requiring confinement, eye, ear, nose, and throat treatment. Hospital with direct payment facilities. This is for emergency care. The following benefits shall be covered accorded to the member during an emergency case who is in critical condition caused by an illness or an injury, like physician service, medicine utilized treatment or for immediate relief, cast dressings and sutures, oxygen and intravenous fluids, x-ray labs, and other diagnostic examination directly related to the emergency management of the patients. For the event landholder get hospitalized in a non-accredited hospital, KAISER will reimburse 80% of the total hospital bills inclusive of professional fees based on Kaiser accredited units. In the case of there is no accredited hospitals in the area, Kaiser will reimburse it with 100%. Please note that Kaiser is also integrated with PhilHealth. Once admitted, you will be advised to file your PhilHealth reimbursement form. The PhilHealth reimbursement due shall be deducted from the total hospital bills. Kaiser members without PhilHealth membership shall shoulder and pay the corresponding portion for PhilHealth. Kaiser True Max eligibility: principal member must at least be 18 years old and above, up to 55, and it can be renewed yearly up to age 64 years old. Let's talk about pre-existing illness. Is this covered? All pre-existing conditions shall be deemed covered by Kaiser only after the lapse of 1 year of continuous membership of the member concerned, and provided that applicable benefits shall not exceed the maximum amount per pre-existing condition disease per year of membership. Those illness or injuries or any adverse medical conditions present prior to and within the first 12 months from the effective date of coverage. Those illness or injuries or any adverse medical conditions present prior to the and within the first 12 months from the effective date of coverage. The member was aware or should reasonably have been aware of the signs and symptoms of such illness, injury, or medical condition. The pathogenesis or onset of such illness, injury, or adverse medical condition has started during the contestability period for membership. These are the list of the pre-existing illness.
Hold me close till I get up. Time is barely on our side.
And here they are the list for dreaded diseases.
I don't wanna waste what's left. The storms we chase are leading us, and love is all we'll ever trust. Yeah, no, I don't wanna waste what's left.
Let's talk about exclusions and limitations. Exclusions and limitation when it comes to hospitalization. Services of a private nurse or doctor, use of extra bed or food, television, DVD, electric fan, admission fee, ID bracelet, thermometer, admission kit, and all other items not directly related to the medical management of the patient. Cost of hospitalization, medicine, medical services, and other expenses incurred as a result of a member's decision to avail of such hospitalization. Medical services, treatment, or procedure not prescribed or contrary to what has been prescribed by the attending Kaiser provider or without Kaiser written report. Hospitalization and treatment outside the Philippines is not covered. For outpatients, prescribed medicines on an outpatient basis are not provided by Kaiser accredited units. Outpatient medical and healthcare services are provided only during clinic hours of Kaiser accredited providers. Second opinions and cost of treatment incurred in a non-accredited provider should the member unilaterally decided to seek such recourse. Here are the other exclusions and limitations.
And on we'll go, through the wastelands, through the highways, till my shadow turns to sun rays. And on we'll go, through the wastelands, through the highways. And on we'll go.
Let's now talk about the insurance part or the rider of Kaiser True Max. How much it will cost you if you really get sick? It says that for a cancer to get treated, you need at least 1.835 million. For heart attack, 950,000 pesos. And for stroke, it needs 1.7 million. Getting any critical illness can easily deplete your life savings. TRO is a lifetime partnership. So TRO is a life insurance partnership with AGS and East West. AGS is a company in Europe which was founded 1824, leading insurer in Europe with presence in 14 countries across Europe and Asia. It has almost 200 years of insurance expertise, and its 2020 group inflows is about 35.6 billion euros, and net results as of 2020 is 1.2 billion. When it comes to East West, it was founded in 1994 with a network of 490 stores and the most consumer-centric bank. 28% net income growth as of September 2020. Introducing Kaiser True Max, your all-in-one plan which gives you as much as 1 million extra cash when you get diagnosed with either cancer, heart attack, or stroke. Plus, your loved ones will get as much as 1 million in extra cash in case at untimely death. Kaiser True Max rider variants, there is Max 100. This is 100,000 critical illness plus 100,000 life protection benefit. Kaiser True Max 300, Kaiser True Max 500, and Kaiser True Max 750 and Max 1,000. Who may avail of Kaiser True Max? Those aged 18 to 55 may apply for Kaiser True Max, and once approved, the plan is renewable up to age 64. What type of critical illness is covered by Kaiser True Max? The products covers heart attack, cancer, or stroke. Will I be covered from day one of policy issuance? For life insurance coverage, it is from day one. For the critical illness benefit, there is a waiting period of 6 months from effective date of reinstatement date of the policy. How do you define heart attack and what is not covered? A clinically diagnosed heart attack or myocardium is as evidenced by all of the following: a history of typical prolonged chest pain, new electrocardiographic changes resulting from the occurrence, and an evaluation of the cardiac enzyme CPK-MB above the generally accepted laboratory levels of normal, or tropopines recorded at the following levels or higher. Angina is specifically excluded. So how do you define cancer and what is not covered? Any malignant tumor positively diagnosed with histological confirmation. A histopath result is necessary with diagnosis of malignancy. The following are excluded: all cancer which are histologically classified as pre-malignant, non-invasive carcinoma in situ having either borderline malignancy or having low malignant potential. All tumors of the prostate, thyroid, and urinary bladder histologically classified as T1NOM or TNM classification. Chronic lymphocytic leukemia less than RA1 stage 3. All cancers in the presence of HIV and any skin cancer including malignant melanoma of less than 1.5 millimeter breast, low thickness, or less than Clark 3. How do you define stroke and what is not covered? A stroke is that leads to a permanent or irreversible neurological weakness that should last continuously for more than 45 days. Diagnosis must be done by MRI or CT scan, and changes should be evident in imaging. Stroke, which leads to a temporary of reversible neurological weakness, is excluded. So what are the other exclusions for the critical illness coverage? Any critical illness due to directly or indirectly to a pre-existing condition. Any critical illness diagnosed within 6 months of effectivity date or reinstatement date of policy, any critical illness which results in death of insured within 30 days of first diagnosis, any critical illness resulting from deliberate self-injury or attempted suicide by the insured, whether sane or insane. What are other exclusions for the critical illness coverage? Suicide within the first year of effectivity of reinstatement unless suicide is committed in a state of insanity. What if I change my mind and I want to cancel my policy and refund for my premiums? We have a free look period of 15 calendar days upon receipt of your statement of insurance coverage. You may cancel your policy with full refund during this time. What does it mean to be actively at work? An eligible individual who is actively at work means an individual who is in good health and who is physically able to perform the usual duties and activities of his livelihood. What is the contestability period of the policy? The policy shall be incontestable after 1 year from effectivity date or the reinstatement date. These are the Kaiser True Max product variants from age 18 to 40.
Hold me close till I get up. Time is barely on our side.
Age 41 to 50.
It's what's left. The storms we chase are leading us, and love is all we'll ever trust. Yeah, no, I don't wanna waste what's left.
Last but not the least, age 51 to 55.
And on we'll go, through the wastelands, through the highways, till my shadow turns to sun rays. And
For Kaiser True Plan, you may contact Paul&Faith Puno. Here are numbers, and you may also add us on Facebook.